What if the most powerful pharmacy in the world isn't behind a counter, isn't behind a prescription, and isn't behind a paywall, but growing right now in fields, forests, and backyards that you've walked past your entire life without a second glance? For most of human history, people healed without pharmaceutical companies, without synthetic drugs, without the FDA. They knew which plant stopped bleeding in under a minute, which root beat stress better than anything in a modern pharmacy, and which common weed could pull venom from a sting like nature's own first aid kit. Then we forgot. And today, I'm giving it all back. 21 forgotten plants that actually heal, backed by modern research, validated by thousands of years of use. Stick around because number 17 may be the most important plant on this list if you have ever dealt with an injury that just wouldn't heal. And number 4 was literally called the soldier's herb for 3,000 years, and it works so fast, military medics in multiple ancient cultures considered it standard field kit. Let's get into it. 1. Plantain, Plantago major, the weed that heals. Let's start here because this one is going to reframe the way you look at your own lawn. And I don't mean the banana, I mean Plantago major, the low-growing, broad-leafed weed with the ribbed leaves, is almost certainly growing within 50 feet of wherever you're sitting right now. It grows in driveways, in sidewalk cracks, in parks, fields, roadsides. You've seen it 1,000 times and probably pulled it out of your garden without a second thought, and that was a mistake. Plantain has been used as a primary wound herb across Native American, European, Anglo-Saxon, and Chinese traditional medicine systems for over 2,000 years. The Anglo-Saxons called it one of the 9 sacred herbs. Native healers chewed it into a poultice and applied it immediately to bites, stings, and cuts. Medieval European herbalists documented it so extensively that it appears in nearly every herbal text written before the 18th century. Here's what modern research has confirmed. Plantain contains aucubin and actioside, compounds with documented anti-inflammatory, antimicrobial, and wound healing effects. Studies show it accelerates wound closure, reduces swelling from insect stings, and helps draw splinters, toxins, and debris out of tissue. The term used in traditional medicine was drawing herb. It pulls things out. And that description turns out to be biochemically accurate. The traditional use is almost absurdly simple. Grab a leaf, chew it or crush it between clean fingers, apply it to the sting, bite, or cut, and hold it there. That's it. Within minutes, most people report the itch and sting of insect bites dramatically reduced. For cuts and scrapes, it acts as a natural antimicrobial poultice. This is the plant we forgot, not because it stopped working. We forgot it because it grows everywhere. It's free, and you can't patent it. 2. Self-heal, Prunella vulgaris. The name says everything. There's a plant that has the same common name in nearly every language it appears in. In Chinese medicine, it's called Zia Ku Kao. In European folk medicine, it was called sicklewort and carpenter's herb. In English, it earned the name self-heal because the evidence of what it did was so obvious, so consistent, that people across completely separate cultures arrived at the same conclusion. Prunella vulgaris is another one you may have overlooked in your garden. Small purple flower spikes, ground-hugging growth. But don't let its modest appearance fool you. Modern research shows prunella contains rosmarinic acid, a compound with impressive antiviral and anti-inflammatory properties. Studies have demonstrated activity against herpes simplex virus, HIV, and various bacterial strains. One study published in the Journal of Ethnopharmacology found that prunella extracts inhibited viral replication in cell cultures at low concentrations. That's not folklore, that's virology. Traditional use focused on wound healing, crushing fresh leaves for cuts and applying as a poultice, as well as using the tea for sore throats, mouth ulcers, and infections. The dried herb was one of the most widely carried in the field kits of traditional healers across Europe. The reason self-heal fell out of use is the same reason most of these plants did. When sulfa drugs arrived in the 1930s and penicillin followed in the 1940s, the entire herbal tradition got dismissed almost overnight as primitive, and for acute, life-threatening bacterial infections, antibiotics were and are genuinely revolutionary. But for everyday viral infections, wounds, and inflammations, the plants were doing something real, something we're only now fully measuring. 3. Mugwort, Artemisia vulgaris, the dreamer's herb, named for the goddess Artemis, carried by Roman soldiers in their sandals to prevent fatigue on long marches. Used in traditional Chinese medicine for over 3,000 years. Featured in Anglo-Saxon sacred herb lists. Burned in Japanese moxibustion therapy as one of the primary healing tools in their entire medical system. Mugwort, Artemisia vulgaris, is one of those plants where you have to stop and ask, why did so many completely separate, geographically distant cultures arrive at the same herb independently? The answer is that it works. Mugwort is bitter, aromatic, and stimulating. Modern research shows it contains sesquiterpene lactones with genuine anti-inflammatory and digestive stimulating properties. It promotes bile production, stimulates digestive enzymes, and has been shown to have antispasmodic effects on the gut. For people dealing with sluggish digestion, bloating, or low appetite, mugwort in tea form was one of the oldest and most reliable remedies across multiple traditions. The Chinese application is even more striking. Dried and compressed mugwort is burned as a moxa stick near acupuncture points to generate therapeutic warmth and stimulate circulation. This practice, moxibustion, has been the subject of modern clinical trials, including a well-known study published in the Journal of the American Medical Association, showing that moxibustion over a specific acupoint successfully turned breech babies to the correct position before birth. The Journal of the AMA, not a holistic wellness blog, JAMA. Traditional use. Small amounts of mugwort tea before meals for digestive support, or burned as moxa for circulation and chronic pain. Note, mugwort is not for use during pregnancy due to its uterine-stimulating properties. But for the rest of us, this is one of the most historically validated herbs on this entire list that almost nobody in the West is using. 4. Yarrow, Achillea millefolium, the soldier's herb. The name gives it away. Achillea millefolium, named for Achilles, the Greek hero who, according to legend, used this very plant to stop the bleeding wounds of his soldiers on the battlefield. That legend is over 3,000 years old. And here's what's extraordinary. We've been finding yarrow packed into ancient wound dressings and burial sites across Europe and Asia for millennia. This wasn't just a story. This was standard medical equipment. Yarrow has one of the most consistent records in the entire botanical medicine tradition. It was used by Native Americans, dozens of tribes independently, for stopping bleeding, healing wounds, and treating fever. It was used by European herbalists, by Chinese physicians, by Civil War field medics, by World War I herbalists when pharmaceutical supplies ran short. The modern science is unambiguous. Yarrow contains achalatin and other compounds that actively promote blood clotting and vasoconstriction. Studies confirm genuine hemostatic, that means bleeding-stopping activity. Additional research shows anti-inflammatory and mild antimicrobial properties. The plant is, in a very literal sense, a natural hemostatic agent that you can apply directly to a wound. Traditional use: crush or chew fresh yarrow leaves and pack them into a cut to stop bleeding. Make a strong tea from the dried herb for fever, colds, and to break a sweat during illness. Use as a wash for infected wounds. Here's the remarkable part. You can grow yarrow in almost any garden. It thrives on neglect. It tolerates drought. And if you ever find yourself with a serious cut and nothing else on hand, a handful of fresh yarrow leaves, crushed and applied with pressure, can genuinely slow or stop bleeding while you get proper care. 3,000 years of battlefield medicine, confirmed by modern hematology. That's what we forgot. 5. Stinging nettle, Urtica dioica, the iron fist in a velvet leaf. If you've ever brushed against stinging nettle on a hike, you know the experience. That immediate burning, stinging sensation across the skin that can last for hours. It's memorable in the worst way. And for centuries, that sting was enough to keep most people away from one of the most nutritionally and medicinally dense plants in the temperate world. That was a costly mistake. Stinging nettle, Urtica dioica, is extraordinarily rich in iron, calcium, magnesium, potassium, vitamins A, C, and K. Ounce for ounce, it rivals or surpasses the nutritional density of most cultivated vegetables. Traditional cultures across Europe, North America, and Asia harvested nettle as a spring tonic, a food, and a medicine for anemia, joint pain, and urinary complaints. Modern research validates the full spectrum of traditional use. Clinical studies show nettle leaf reduces inflammation associated with allergic rhinitis, hay fever, by inhibiting the same pathways targeted by antihistamine drugs but without the sedation. Studies on nettle root show significant benefits for benign prostatic hyperplasia, reducing nighttime urination and improving flow. And the anti-inflammatory data is compelling, with multiple studies showing reduced markers of systemic inflammation in participants taking nettle extract. The iron content alone makes this plant remarkable for anyone dealing with fatigue, especially women with heavy menstrual cycles. Nettle tea made from the dried leaves is one of the most mineral-rich beverages you can consume. Traditional use: blanch fresh nettle leaves, which destroys the sting, and eat as a vegetable. Dry and make tea. Use the freeze-dried leaf capsules for allergy support. Apply the fresh sting intentionally to arthritic joints, a practice called urtication, which, bizarrely, has actual clinical evidence behind it for pain relief. The plant stings to protect itself. The irony is that the sting itself is therapeutic. Nature rarely wastes anything. 6. Echinacea, the prairie medicine. Before European colonization, the Great Plains of North America had no pharmaceutical infrastructure. What they had was an extraordinary botanical pharmacopoeia, developed over thousands of years of close observation and clinical use. Echinacea, Echinacea purpurea, angustifolia, and pallida was arguably the most important herb in the entire tradition of Plains Indian medicine. Over 30 Native American tribes used Echinacea for more conditions than almost any other plant: infections, wounds, toothaches, snakebite, sore throats, colds, fevers. When 19th-century American physicians began documenting native botanical knowledge, Echinacea was the herb that immediately attracted attention. By the 1890s, it was one of the most widely prescribed herbs in American medicine. Then came the pharmaceutical revolution. Echinacea got pushed out, called unscientific, and then the research caught up. Meta-analyses of randomized controlled trials now consistently show that Echinacea preparations reduce the duration and severity of upper respiratory infections. A comprehensive Cochrane review examined 24 randomized trials and concluded that certain Echinacea preparations are significantly more effective than placebo in preventing and treating the common cold. The mechanism involves genuine immune modulation, increasing the production and activity of white blood cells, stimulating macrophage activity, and enhancing interferon production. Traditional use: tincture or tea at the onset of cold or flu symptoms. Short-term use during acute illness rather than daily supplementation. The root preparations of E. angustifolia are considered most potent. What was forgotten, and is being remembered, is that immune support doesn't mean immune stimulation. Echinacea teaches the immune system to respond correctly. That's a level of sophistication that took us a century of dismissal to finally understand. 7. Calendula, the surgeon's flower. During the American Civil War, battlefield surgeons ran out of supplies. They used what they could find. Calendula, bright orange and yellow flowers growing in whatever gardens had survived near the camps, was packed directly into wounds, not as a last resort born of desperation, but as a deliberate choice, because surgeons who had studied European herbal medicine knew it worked. Calendula officinalis, the pot marigold, has one of the longest continuous records as a wound herb in Western botanical medicine. It was standard in European apothecaries for centuries. It was in medical military kits. It was the herb that nurses and herbalists used for burns, rashes, surgical wounds, and skin infections when nothing else was available, and often when everything else was available, because it was reliably effective. Modern research explains why. Calendula contains triterpenoids, flavonoids, and polysaccharides that promote wound healing, reduce inflammation, and have genuine antifungal and antibacterial effects. Clinical trials show calendula cream outperforms petroleum jelly for wound healing and is comparable to pharmaceutical preparations for radiation dermatitis in cancer patients undergoing radiation therapy. That last finding came from an actual oncology trial, calendula against radiation burns. It held its own. Traditional use: calendula-infused oil applied to burns, rashes, dry skin, and wounds. The tea as a gentle anti-inflammatory for gut health. The cream as a general skin healer for everything from diaper rash to eczema to surgical scars. The Civil War surgeons weren't desperate when they packed flowers into wounds. They were applying centuries of validated knowledge. We just forgot to tell the next generation of doctors. 8. Lavender, the nervous system's reset button. In 1910, French chemist René Maurice Gattefossé burned his hand severely in a laboratory explosion and plunged it into the nearest liquid available. which happened to be a container of lavender essential oil. He reported remarkable healing with minimal scarring and credited the oil. This incident is often credited as the founding moment of modern aromatherapy. Whether or not the story is perfectly accurate, the underlying science is real. Lavandula angustifolia is one of the best-studied plants in the world for its effects on the human nervous system. The linalool and linaloyl acetate compounds in lavender act on GABA receptors in the brain, the same receptor system targeted by benzodiazepine drugs like Valium and Ativan, but without the addictive potential or cognitive side effects. Clinical trials using oral lavender oil preparations, particularly a standardized product called Silexin, have shown significant reductions in generalized anxiety disorder, with effect sizes comparable to low-dose pharmaceutical anxiolytics. Inhaled lavender reduces cortisol levels, improves sleep quality, reduces heart rate in high-stress situations. These aren't self-reported wellness outcomes. These are measured biomarkers in peer-reviewed studies. Traditional use: the dried flowers as a sleep sachet, lavender oil applied topically for headaches, burns, and insect bites, and the tea as a gentle, calming nervine. The essential oil diffused in a bedroom has demonstrated, in multiple trials, improvement in sleep duration and quality. Lavender became associated with potpourri and bath products, and in doing so, lost its identity as serious medicine for anxiety, nervous system dysregulation, and chronic stress. It was demoted from pharmacy to gift shop. The research is busy promoting it back. 9. Chamomile, the doctor of the garden. The ancient Germans called chamomile alles Zutraut, capable of anything. That's a bold claim. But when you look at the breadth of chamomile's validated therapeutic activity, the arrogance of that name starts to look more like earned confidence. Matricaria chamomilla, German chamomile, has been used as a primary medicinal herb across ancient Egypt, Greece, Rome, medieval Europe, and through to the present day. It's one of the most consumed herbal teas globally, and while we've reduced it to something you drink when you have a stomachache, traditional medicine used it for inflammation, wound healing, digestive spasms, anxiety, skin conditions, and sleep disturbance. Modern research validates every single one of those applications. The compound apigenin binds to GABA-A receptors in the brain, producing anxiolytic and mild sedative effects. Bisabolol and chamizoline produce genuine anti-inflammatory effects comparable to low-dose hydrocortisone in topical applications. Clinical trials show chamomile extract reduces symptoms of generalized anxiety disorder. Multiple studies show its effectiveness for gastrointestinal spasms, reducing colic in infants and accelerating the healing of gastric ulcers. Traditional use: strong chamomile tea for digestive complaints, anxiety, and sleep. Chamomile-infused oil or cream for skin inflammation, eczema, and wound care. A chamomile steam for sinus congestion and skin treatment. The Germans who named chamomile capable of anything weren't being poetic. They were being precise. We just forgot to take it seriously. 10. Lemon balm, the forgotten antiviral. Here is a plant that medieval European monasteries grew in every physic garden as standard practice, that 17th century herbalist John Gerard called sovereign for the heart and spirit, that was used across European folk medicine for over 1,000 years. And that most people today know only as a pleasant-tasting tea ingredient. Melissa officinalis, lemon balm, has a distinctive lemon scent, grows easily in most gardens, and contains rosmarinic acid along with a suite of polyphenols with genuine antiviral activity. The antiviral data is striking. Multiple studies show that lemon balm extract inhibits the replication of herpes simplex virus type 1 and 2, with topical preparations showing significant reduction in healing time and recurrence frequency in cold sore treatment. A randomized controlled trial found lemon balm cream reduced both the duration of outbreaks and symptom severity compared to placebo. That's an antiviral effect from a common garden herb. Beyond antiviral activity, lemon balm is one of the most well-documented anxiolytic herbs in the botanical pharmacopoeia. Studies show it reduces anxiety and improves mood in acute stress situations. Combined with valerian, clinical trials demonstrate improved sleep quality. It inhibits GABA transaminase, increasing available GABA in the brain, the same mechanism, again, that pharmaceutical sedatives exploit, but through a gentler, non-addictive pathway. Traditional use: fresh leaf tea for anxiety, stress, and nervous headaches. Topical cream or extract for cold sores at the first sign of tingling. Regular tea consumption for antiviral immune support. The monastery herbalists grew it because they understood what it did. We have the pharmacology now to explain exactly why. If you're halfway through this list and you're realizing that your backyard might be more of a pharmacy than your medicine cabinet, that's not an accident. That's what happens when you start looking at plants the way our ancestors did, as medicine first, decoration second. Hit that like button if this is changing the way you think, and keep watching, because the second half of this list is where things get really interesting. 11. Ginger, the root that outperforms pharmaceuticals. There is a clinical trial, a real randomized controlled clinical trial that compared ginger to Dramamine for motion sickness. Ginger won. There is another comparing ginger to vitamin B6 for pregnancy-induced nausea. Ginger matched it on efficacy with a dramatically cleaner safety profile. Zingiber officinale has been used as primary medicine in Ayurvedic, Chinese, and Middle Eastern medical systems for over 5,000 years. It is, arguably, the most clinically studied medicinal spice on Earth. And the evidence has made the pharmaceutical industry uncomfortable because ginger keeps showing up as competitive with or superior to synthetic options in areas where it was never supposed to compete. The active compounds, gingerols and shogaols, have profound anti-nausea effects by acting on serotonin receptors in the gut. They have anti-inflammatory activity that rivals NSAIDs for muscle pain. Studies show ginger supplementation reduces markers of inflammation in osteoarthritis patients, decreases muscle soreness after exercise, and reduces menstrual pain as effectively as ibuprofen in one direct comparison trial. Traditional use: fresh ginger tea for nausea, digestion, and colds, ginger compress for joint pain, dried ginger capsules for chronic inflammation and blood sugar support, the root that outperforms Dramamine, the root that matches ibuprofen for menstrual cramps. We put it in baked goods and forgot it was medicine. 12. Turmeric, the golden standard. If you told a conventional physician 20 years ago that a yellow kitchen spice might outperform corticosteroids for inflammatory bowel disease management, they would have ended the conversation. Today, that conversation is happening in gastroenterology journals. Curcumin, the primary active compound in curcuma longa, turmeric, has generated over 12,000 peer-reviewed publications. It inhibits NF-kappa B, one of the master regulators of inflammatory gene expression in the human body. It modulates COX-2 enzymes, the same enzymes targeted by Celebrex and ibuprofen. It has demonstrated activity against inflammation pathways involved in cancer, cardiovascular disease, neurodegeneration, and autoimmune conditions. The challenge with turmeric is bioavailability. Curcumin is poorly absorbed on its own, which is why traditional Ayurvedic medicine always combined it with black pepper, containing piperine, and with fat. This wasn't culinary preference. It was pharmaceutical knowledge. Piperine increases curcumin absorption by up to 2,000%. Traditional cooks in India were optimizing drug delivery thousands of years before pharmacokinetics existed as a field. Traditional use: turmeric with black pepper and fat for inflammation, joint pain, and chronic disease prevention. Golden milk, turmeric, black pepper, and warm, full-fat milk as a traditional Ayurvedic night preparation. Topical paste for skin inflammation and wounds. 12,000 studies. Used for 4,000 years. Still classified as a spice. 13. Ginseng, the adaptogen that built empires. In ancient China, wild ginseng root fetched prices that could bankrupt small provinces. Wars were fought over ginseng territory. Emperors consumed it daily. The name Ren Shen, man root, reflects the anthropomorphic shape of the root and the ancient belief that it embodied human vital energy. Panax ginseng, and its American cousin Panax quinquefolius, belongs to a category of herbs called adaptogens, plants that improve the body's nonspecific resistance to stress, increasing resilience across multiple physiological systems simultaneously rather than targeting a single symptom. Modern research on ginseng is extensive. Clinical trials show ginsenosides, the primary active compounds, improve cognitive function, working memory, and mental endurance. Studies demonstrate enhanced physical performance, reduced fatigue, improved immune function, and preliminary evidence of blood sugar regulation. A comprehensive review in the Cochrane database found evidence supporting cognitive enhancement in healthy adults and patients with early cognitive decline. The adaptogen concept itself, the idea that a plant can broadly improve stress resilience across multiple systems, was considered fringe science until the research made it untenable to dismiss. Ginseng was the herb that forced the conversation. Traditional use: ginseng root tea, or standardized extract for mental and physical fatigue, immune support, and as a long-term tonic for stress resilience. Red ginseng, steamed and dried, for more stimulating energy support. White ginseng for gentler, more sustained effects. The emperors weren't wrong. The price of wild ginseng reflected something real. 14. Ashwagandha, the stress killer. The translation of ashwagandha from Sanskrit is typically given as smell of horse, a reference to both its distinct aroma and the traditional belief that it imparts the strength and vitality of a horse to the person who consumes it. That sounds like folklore. The clinical data suggests the folklore was close to accurate. Withania somnifera is arguably the most important herb in the Ayurvedic tradition, a 5,000-year-old medical system that rivals the sophistication of any contemporaneous medical tradition globally. Ashwagandha was prescribed for physical weakness, nervous exhaustion, sexual dysfunction, immune deficiency, and the general category of depletion that comes from chronic stress and overwork. Modern clinical research has been remarkable. Multiple randomized controlled trials show ashwagandha supplementation significantly reduces serum cortisol, the primary stress hormone, compared to placebo. Studies show improved stress and anxiety scores, enhanced sleep quality, and increased testosterone levels in men with low normal testosterone. A trial published in the Journal of the International Society of Sports Nutrition found significant improvements in muscle strength and recovery in resistance training participants taking ashwagandha extract. Cortisol reduction, testosterone support, sleep improvement, muscle recovery. These are outcomes that the pharmaceutical industry would celebrate if a synthetic compound achieved them. In ashwagandha, they're achieved by a root that grows in India and North Africa and has been prescribed by traditional physicians for 5 millennia. Traditional use: ashwagandha root powder in warm milk before bed for sleep and recovery. Standardized extract capsules for chronic stress and hormonal support. The 5,000-year prescription gets its mechanism explained. Nothing else changed. 15. Aloe Vera, the immortality plant, returns. You already know aloe, the clear gel in your bathroom, the sunburn remedy. But aloe vera, true aloe, has a recorded history of medicinal use stretching back to the ancient Egyptians, who called it the plant of immortality. Cleopatra reportedly used it as a core component of her skincare regimen. Alexander the Great reportedly diverted military campaigns to secure islands with aloe groves to treat his soldiers' wounds. These weren't cosmetic uses. These were medical ones. The gel contains over 75 active compounds, including acamanin, a polysaccharide that has demonstrated genuine wound healing, immune modulating, and anti-inflammatory activity. Clinical studies show aloe gel accelerates burn healing, reduces post-surgical wound healing time, and outperforms petroleum jelly for numerous skin healing applications. Internal use of aloe juice, the inner gel, not the latex, has demonstrated benefit for irritable bowel syndrome and inflammatory bowel conditions. What's remarkable about aloe is that we never fully forgot it, but we drastically reduced its status. We turned a plant revered by Egyptian physicians and used to dress the wounds of conquering armies into a bathroom novelty, the thing you grab when you stay in the sun too long. We forgot that Cleopatra's skincare was pharmaceutical, that Alexander's aloe groves were military medical infrastructure. Traditional use: fresh gel from the leaf applied directly to burns, cuts, and inflammatory skin conditions. Aloe juice internally for gut inflammation. The plant of immortality deserves a more serious reading than your bathroom shelf has been giving it. 16. Witch hazel, the tannin that tightens. Hamamelis virginiana doesn't have a mystical origin story. It has something better. It has the most thorough indigenous North American medicinal documentation of perhaps any plant, with Iroquois, Potawatomi, Menominee, and Mohegan peoples all independently developing sophisticated applications from its bark and leaves for bleeding, inflammation, bruising, and skin conditions. When European settlers arrived, they observed and they adopted, and witch hazel became one of the most widely used medicinal plants in North American practice for 200 years, before it got reduced to a shelf ingredient in facial toners. The active constituents, tannins, gallic acid, procyanidins, produce genuine astringent, anti-inflammatory, and hemostatic effects. The tannins bind to proteins in skin and mucous membranes, tightening tissue and reducing weeping and inflammation. Clinical studies confirm efficacy for atopic dermatitis, hemorrhoids, wound care, and minor skin irritations. One well-controlled trial showed witch hazel preparations reduced skin inflammation as effectively as mild hydrocortisone cream. Traditional use: Distilled witch hazel applied topically for bruises, hemorrhoids, inflamed skin, varicose veins, and minor wounds. Poultice from the bark for more intensive applications. The facial toner exists because witch hazel works. We just forgot it was originally medicine, not cosmetics. 17. Solomon's seal, Polygonatum biflorum, the tendon healer nobody talks about. This is the one I promised you. And if you've ever dealt with a joint injury, a tendon problem, or a connective tissue issue that just wouldn't heal, this is the entry you need to take notes on. Solomon's seal, Polygonatum biflorum and related species, is one of the most respected herbs in both traditional Chinese medicine and the Native American Iroquois tradition, used specifically for lubricating and healing tendons, ligaments, cartilage, and connective tissue. It was given to people returning from injury, given to older people whose joints had dried and stiffened, given to anyone with a physical repetitive strain that had resisted healing. The modern scientific investigation is still catching up, but what's been found is intriguing. Polygonatum species contain steroidal saponins and polysaccharides that modulate collagen synthesis and have anti-inflammatory effects on connective tissue. Traditional herbalists describe Solomon's seal as able to moisten and lubricate connective tissue, an observation that aligns with its apparent effects on hyaluronic acid and synovial fluid production. What makes Solomon's seal remarkable isn't just what it treats, it's the specificity. Most herbs are broadly anti-inflammatory. Solomon's seal has a reputation in every tradition that used it for working specifically on tendons and ligaments. That level of tissue specificity is unusual in botanical medicine. It's the kind of thing that gets dismissed as traditional superstition until someone does the receptor study and finds out the traditional healers were describing pharmacology they couldn't name. Traditional use: the root decoction for joint and tendon injuries, chronic joint pain, and connective tissue repair. Topical infused oil for external application to injured joints and tendons. This is the plant that almost nobody in the natural health world talks about, which means it's the plant that most people with the most common injuries never try. That's the real tragedy of forgetting. 18. Trillium, the midwife's herb. Trillium erectum and its relatives were among the most important plants in Eastern North American indigenous medicine, used specifically by midwives for hemorrhage control during and after childbirth. The common name birthroot tells you exactly what it was for. The roots contain steroidal saponins with documented effects on uterine smooth muscle and hemostasis. Traditional use included trillium root preparations to stop postpartum bleeding, support difficult labors, and as a styptic for general excessive bleeding. The specificity of this herb to bleeding control, particularly in obstetric contexts, is one of those cases where traditional knowledge was so precise, so consistent across multiple tribal traditions, that the pharmacology essentially wrote itself. Herbalists documenting 19th century American botanical medicine noted it consistently as one of the most reliable herbs for hemorrhage. Modern use has appropriately become cautious, given its potency and the specific clinical contexts of its traditional use. But as a wound herb and astringent for general external application, Trillium preparations represent serious botanical medicine that deserves continued study rather than the quiet disappearance it has mostly suffered. Traditional use: external application for wounds and bleeding. Internal use, historically under skilled practitioner guidance only for specific circumstances. This is a plant that reminded people, before hospitals, before surgical suites, before blood banks, that nature had an answer for hemorrhage. We should not forget it simply because we now have better alternatives in clinical settings. 19. Wild onion, the antimicrobial that grows everywhere. Allium canadense wild onion is the ancestor of the bulb on your kitchen counter, what the cultivated onion retained in domestication. Wild onion has in abundance a more concentrated version of the same sulfur compounds that make the allium family one of the most medicinally significant plant groups in human history. Indigenous North American use of wild onion was extensive for respiratory infections, ear infections, intestinal worms, as a wound application, and as a primary food medicine during illness. The same compounds responsible for its pungent smell, organosulfur compounds including allicin precursors, have documented antimicrobial activity against a broad spectrum of bacteria, fungi, and parasites. In communities without access to pharmaceutical antibiotics, wild onion wasn't a folk curiosity. It was primary care, applied to infected wounds, consumed to fight internal infections, used as a respiratory steam. And the people who used it weren't making things up. They were applying thousands of years of observation that the underlying chemistry has now validated. Traditional use: poultice from crushed fresh bulb for infected wounds, tea from the bulb for respiratory infections and immune support, consumed regularly as immune maintenance. Your backyard may have wild onion in it right now. Most people spray it with herbicide. That's not an exaggeration of the problem with forgetting. That's a precise illustration of it. 20. Maidenhair Fern, the forgotten lung herb. Adiantum capillus veneris, maidenhair fern, has one of the most visually delicate appearances of any plant on this list. Thin, fan-shaped leaflets on wire-like black stems, the kind of plant people put in terracotta pots in corner bookshelves, not the kind of plant you immediately associate with medicine. But across Arabic, Ayurvedic, and European herbal traditions, maidenhair fern was a primary respiratory herb, used for coughs, bronchitis, asthma, excess mucus, and congested lungs. The medieval Arabic physician Ibn Sina, Avicenna, included it in his canon of medicine for chest complaints. European herbalists prescribed it as a soothing expectorant. The fern contains mucilaginous compounds that coat and soothe irritated mucous membranes, along with flavonoids that have mild anti-inflammatory and expectorant effects. Traditional preparations as a syrup or tea were used specifically for dry, irritated respiratory conditions where soothing and loosening mucus was the goal. In an era where respiratory illness is ubiquitous and most cough preparations are either suppressants or pharmaceutical expectorants with significant side effects, the gentle effectiveness of maidenhair fern as a soothing respiratory herb represents something worth recovering. Traditional use: tea or syrup from the fronds for coughs, bronchitis, and congested respiratory conditions. The most delicate plant on this list was once prescribed by the most influential physician of the medieval world. Appearances deceive in both directions. 21. Indian mallow, Abutilon indicum, the pain reliever from the margins. We save the last spot for a plant that most Western herbalists have never heard of, that doesn't appear in American or European herbal traditions, and that has been sitting quietly in Ayurvedic and traditional South and Southeast Asian medicine for centuries, doing work that deserves a much larger audience. Abutilon indicum, Indian mallow, a soft, velvety-leaved plant with small yellow flowers that grows freely across tropical and subtropical Asia, is one of the most comprehensively used plants in the Ayurvedic tradition for pain and inflammation. The root, leaves, and seeds each have distinct medicinal applications. The plant is used for joint pain, nerve pain, inflammatory conditions, urinary complaints, and wound healing. Modern pharmacological research has found what traditional practitioners described as significant anti-inflammatory effects via cyclooxygenase inhibition, the same mechanism as ibuprofen, along with analgesic activity, antioxidant properties, and preliminary evidence of neuroprotective effects. Multiple studies published in pharmacological journals have confirmed anti-inflammatory activity in animal models at levels that would, in a pharmaceutical compound, generate significant industry interest. The reason most people haven't heard of Indian mallow isn't that it doesn't work. It's that it grows in regions and exists within traditions that Western pharmaceutical development has systematically ignored. The plants of the global South have served billions of people for centuries, with a fraction of the research attention given to European and East Asian botanical traditions. Traditional use: leaf poultice for joint and nerve pain, root decoction for urinary complaints and inflammation, seeds for their demulcent properties. The last plant on this list is a reminder that the forgotten pharmacopoeia isn't just in your backyard. It's in traditions and regions that the modern world has been too quick to overlook. 21 plants, from the weed in your driveway to the root prescribed by medieval Arabic physicians. From the herb that stops battlefield bleeding in minutes to the adaptogen that the modern testosterone research community is only now catching up to. From the common kitchen spice that 12,000 studies have been written about, still filed under condiment, to the tendon healer that nobody in your gym's supplement aisle has heard of. Here is what all 21 of these plants share. They were known, they were used, they worked, and then, through a combination of pharmaceutical economics, institutional dismissal, and the very human tendency to mistake novelty for progress, they were forgotten. Not permanently. Plants don't care whether we remember them. They keep growing. But we pay the price for forgetting. We pay it in pharmacy bills. We pay it in side effects. We pay it in the gap between what medicine could offer us and what it does. The recovery isn't about rejecting modern medicine. Antibiotics save lives. Emergency surgery saves lives. The pharmaceutical revolution produced genuine miracles. But the binary choice, either pharmaceuticals or plants, either modern or traditional, is a false one. The plants and the science were always pointing at the same reality. We just stopped listening to half the conversation. Start listening again. If this video changed the way you see the plants around you, smash that like button. It takes 1 second, and it helps this reach the people searching for exactly this information. Drop a comment and tell me which plant on this list you're going to try first. I read every single one. And if you haven't subscribed yet, what are you waiting for? Every week we go deeper into the intersection of ancient wisdom and modern validation, the kind of health knowledge that doesn't need a prescription because it's been growing outside your door for thousands of years. The pharmacy was never as far away as we thought. It was just waiting for us to look down.